Good afternoon, everybody, and welcome to this week's Facebook Live. As always, I'm Justin Westmiller, the Director for Homeland Security and Emergency Management, and we have Dr. Annette Mercatante. There you go. That's who she is. So let's jump right into it, like we always do. Totals to date: 17,946 total cases, 730 total hospitalized, 394 deaths, with 10,256 people currently recovered. Changes in the last 7 days: we've had 368 new cases. We're averaging 52.5 cases per day on a 7-day average, and 332 tests per day, and that puts us at a percent positive of 10.5%. Now you see the graph that we show every week, and we are continuing to come down, but it's starting to plateau. And I think Dr. Mercatante will talk more about that here in a few minutes. And then this is our percent positive, talking about testing. You can see we've lagged on testing the last 2 weeks, but we continue to see it right around 10%. Number of COVID-19 vaccine distributed throughout the county is 102,326. And then total distributed to the county is 123,000 and some change. That puts us around 45%. And then, as always, you can find the up-to-date information at stclaircounty.org/offices/health/COVID19.aspx.
Hey, I want to say too, the good news, I just want to go back to that vaccine. The good news, I just noticed that our 65 and older is close to 70% now, which is, of course, where we want the whole community to be, and just shows that it can be done. And it can be done. Let's stay positive about that. We're going to get there.
Yeah, and all right. Some of the things I wanted to talk about today. Sorry, Jen, go ahead. I was going to talk about
No, go ahead.
So, as you all know or may not know, Pfizer was approved for 12 and over as of yesterday afternoon. The ACIP endorsed it, and the FDA approved it, which is really good news. Today at the nightclub at 1195 Gratiot Boulevard, where we've been doing community vaccination clinics for quite a while now, they will be open until 7 p.m. Some of the caveats: youth ages 12 to 15, the parent or guardian must be there on site. And for 16 and 17, you must just have a parental consent signed. So there's a little difference there.
Yeah, and I should, make a plug for also our diversity initiative, who's been just relentlessly out there every weekend, also providing vaccine on the South Side. And they have a walk-in COVID vaccine clinic this coming Friday and Saturday at the Harvey Reinvestment Center on 24th Street. That's 3013 24th Street. And they will also be providing Moderna and Pfizer vaccine. So that's now they'll be able to provide for 12 and older as well. So that's 12 noon till 6 p.m. on Friday, May 14th, and 10 to 4 p.m. on Saturday, May 15th. So several opportunities just this week alone. And then, of course, next week we'll be looking at more community-based opportunities, including at some schools. So.
All right, thank you. All right, Doc, can you talk about the quarantine changes that we put out yesterday?
Sure. Actually, we implemented some of them earlier last week because, we want to keep this the end of the school year, and there was a lot of discussion about all the kids that were getting quarantined with CDC having guidelines in place that were less stringent than the ones that MDHHS has promulgated. And in addition to a lot of the discussions about how the MDHHS orders do not require quarantine or isolation type parameters, we had a good opportunity to loosen those restrictions so that more kids could stay in school. So we went to, for the entire county, a 10-day quarantine period. This is similar to what we did before the last surge with the variant. So 10 days without a test, you can return to your work or school or environment where you're exposing yourself to other people, as long as you're not ill. Okay, so you need to be feeling better as well. And for those last 4 days, you still want to make sure that you're paying attention to your symptoms, wearing your mask, and remembering that at any point you could still become infectious. So 10 days with those ongoing precautions for 4 more days. That's for everyone. The other thing, though, for classroom only exposures, and these are in classrooms that are following our masking and other mitigation strategies. There's some data that was released in February that supports the idea that 3 feet has no greater risk than 6 feet, although there is a risk of exposure. Even at 10 feet, that risk at 3 feet and 6 feet is really not significantly different. And therefore, we're now letting the schools use a 3 feet distance parameter to decide who's had an exposure if there's a case in the classroom. And that's only for the classroom. At this point, we're not expanding that to the cafeterias or the hallways or the school buses, and it's certainly not applicable to your work environment. So just K through 12 for now, because that is the only data that we have is related to K through 12 classrooms that are masking and following other cleaning and other mitigation strategies. So we're going to follow the data and provide that amount of changes. And I think that that alone has gotten a lot of our kids back into school, which we're really happy about. So we will continue to look at every opportunity to make things easier and to get people back to their normal lives. And more to come as we talk about it more.
Okay. I also wanted to talk today about our change with our Everbridge pre-registration system. Can you talk a little bit about that?
Oh, sure. So, yeah, I've kind of been talking about our Everbridge system is not filling up with thousands and thousands of people anymore. And so as of Friday, May 21st, we will no longer be using that system in any kind of pre-registration capacity. For those who are still in the system, they will get a final message sent to them. And on the Monday following, May 24th, we will have a new link on our website that will allow people to self-schedule an appointment for their COVID-19 vaccines, or I might add for any of their vaccines. And you'll be able at that point, because it's our own Patagonius is the system we use internally. It will allow you to select the date and time that works best for you. And that system you will come to the health department and receive the vaccines here.
Okay. Thank you, Doc. We will be though, however, at the nightclub through the end of the month. And then those new changes here on site will happen in June. Okay. As far as some questions that came in last night, Justin, will my name be automatically removed from the Vax call list? I'm double vaxxed, all set, but the calls keep coming.
So yes, it's supposed to, but what it misses sometimes is people who get vaccinated in other places. So if, or some other issues, but if for any reason you're still getting calls and you've already been fully vaccinated, please send us an email at covid19@stclaircounty.org and let us know what's going on, and we'll take your name out of the database. It's pretty easy.
Or by the end of the month, it'll be a mute issue anyways.
Right.
Okay.
But we don't want you to get those calls every day until the end of the month. So let us know, and we'll
get them all the
out.
time. Robocalls, come on, it's part of life.
Yeah.
All right, the next question is, I'm all for giving the 12 to 15-year-olds the Pfizer vaccine, but it seems that giving them other vaccines at the same time is not the best idea. I feel other vaccines could wait until after the Pfizer is completed. What are your views on this?
Yeah, well, that's a really important question. And the ACIP actually had one of their more robust discussions about this on Wednesday and weighed in that it is, in fact, perfectly safe to provide whatever vaccines you need all at the same time. The precaution not to do that for 14 days for a COVID vaccine was really out of precaution, and there's been ample opportunities now to review that information. Millions of doses provided. I was saying 300 million, but I think it's more like 195 million. I got to get my millions right. So lots and lots of vaccine. The other thing to remember is there isn't a vaccine we have that is not okay to use simultaneously with other vaccines. Your immune system is capable of responding to 1,000,000 times of the antigens that are provided in a single vaccine. So really, we know already scientifically and medically that this is okay. Am I okay with it? Absolutely. And the reason why is this last year and a half has been terrible for our vaccine rates. People have not done a lot of things, including getting vaccinated, and our vaccination rates are way, way down. And what that means is we are now vulnerable to other vaccine preventable diseases, everything from chickenpox to measles, as our vaccine rates stay low. So we are anxious to get those vaccines up, and we know that vaccine opportunities, if you miss them, they don't happen. So the best way to get vaccine rates up is to just give people all the vaccines they need at a single visit, so that they don't have to worry about coming back.
All right, thank you. All right, Justin, why did the cases seem to be going back up?
So they're not really going back up. I think one day, yesterday or the day before, we had a significantly higher number, but we're kind of holding out between that 30 and 50 number right now. And that's why I talked a little bit about a potential plateau. Now, what I will say is we're plateauing a little higher than we want to. So, we're just going to have to keep working on getting those vaccinations done and working through the folks that are continuing to come up positive.
Thank you.
And I've said this
Dr.
before. I just want to,
go ahead.
I'll just say this, the day-to-day variables also have a lot to do with data collection and the state surveillance system that gets adjusted. And so again, don't get caught up in the day-to-day numbers. It really is that trend that's important, and the averages that we come up with at the end of a whole week. That's much more reliable and meaningful to look at that information.
All right, thanks. All right, how can we get the doctors in St. Clair County on board to support the vaccine? I've spoken to many individuals that tell me their doctors have told me not to get the vaccine.
Well, being a doctor myself, I can just say that there is a lot on their plate, and there's a lot of information they have to keep up with. This pandemic has been a real challenge to keep up with. I do it every single day now. This is all I've been doing, and I still don't know everything there is as it comes out. It's just challenging to keep up with this. So number one, I think it's going to take them a little more time to kind of catch up with the emerging literature. And sometimes, I don't want to make an excuse, but I think sometimes they're just too busy to really kind of spend the time looking at it. They will. And I think, unfortunately, some are just are keeping up with it a little better than others. Meanwhile, we have doctors' calls every month. We have in-service ongoing education. I'll continue to push and make sure that information gets in front of them, and we'll just go from there.
All right, thanks. Justin, this person had asked, I have COVID. Why do I need to be vaccinated? I've also been exposed after I had COVID the first time, and I never got it again. Why are you still pushing vaccination?
That's easy. So the wild, after you've been infected with the wild disease, there's plenty of variants running around now, and those variants are also potentially, they can break through that wild protection that you may have. So the vaccines are covering most of the variants, or almost all of the variants that we've been informed of, and we know that also the wild protection is potentially for a much shorter time than the vaccine. So it is recommended that after you're starting to feel better from COVID, you should get the vaccine.
Okay.
Yeah, in other words,
question.
the protection from the vaccine is just better. Simply put, the immunity from vaccines is just better and longer lasting. So it's not just good for you, it helps prevent the ongoing transmission and the spread. Remember, vaccines aren't just for your health, it's also for trying to contain the spread of this disease in our community. And with better immunity, you don't have as much spread through the community. So I'm sorry.
Thank you.
Jen, I'm just kind of
That's okay.
cutting you off constantly today.
You're
So,
cutting me
sorry.
off. All right. Next one. A friend has a 17-year-old daughter and has concerns regarding future fertility with the Pfizer vaccine. She feels there are many unknowns and wonders if waiting 1 year until she can make her own decision and more data may be available.
Well, there's two
Maybe available, but not
pieces
a better
there.
decision.
Yeah, so two pieces of that. One is the fertility question that is quite honestly a myth. It's a falsehood that began with some obtuse comments made about the remote relationship between amino acid chains in the COVID spike protein and amino acid chains in a placental protein. And that doesn't mean the proteins are similar, but the thought, what the comment was, well, if our immune system will attack the COVID protein chains and there's a similarity to a placenta, it'll attack the placenta too. First of all, scientifically and plausibly, it's everyone's weighed in on this and said no, the similarities aren't even remotely close enough to cause a cross immune response like that. Okay, it's like kind of like saying you don't want to use the two social security numbers will get confused because they both have sixes in them. Right? There's amino acids are the building blocks of protein, and there's lots and lots of them in a protein. So having a few that are similar does not in any way make the protein similar. So number one, theoretically and plausibly, this isn't. And the other thing is that we absolutely have no evidence to support this. People who get COVID and mount an immune response do not have fertility issues or terminated pregnancy issues. There is historically absolutely no vaccine that impacts fertility in any long-term way. So there's just a nothing here, and I would not be concerned about fertility in any way. Now let's go to the second, and by the way, this has been weighed in by the American College of Obstetricians and Gynecologists. I mean, everyone who's looked at this has just said, no, it's just a myth that just, what's really important to young women is their future fertility. So I think it's just kind of a poke that just resonates with people emotionally, and that's why it's sticking. But let's go to the idea of waiting. So what can go wrong if you wait? Number one, of course, by waiting, your daughter can get infected. But probably more important, by waiting, you're not helping the community stop this terrible pandemic. The longer people wait, the longer we are going to have to deal with these recurrent surges and these flare-ups. And the goal really is to get back to our lives and worry about other things besides COVID. So waiting is a detriment to her. It's a detriment to our society. And on top of that, you're waiting for reasons that aren't really valid. So I don't know. I don't want to say this, but that's really the bottom line. And don't forget that waiting only. So we've got millions and millions of vaccines. Do you know how many vaccines were distributed? I was saying three. We're going to look that up because it's not what I was saying, but it's I think at least 100 million vaccines. And out of all of those vaccines, we have, I've already said this a million times, but we have 4 robust post-vaccine surveillance systems. We would have seen any kind of problem that wasn't detected in the clinical trials by now. And we're not. We're not seeing excess deaths from the vaccine. We're not seeing autoimmune disorders from the vaccine. We're certainly not seeing any fertility or product of conception problems with the vaccine. So we have lots of reasons to be reassured.
Yeah, I mean, if I can just jump in too.
265 million vaccines. I thought it was close to 300 million. 265 million.
Yeah.
Okay.
And just to show evidence of what Dr. Mercatante is talking about, of the 7.8 million Johnson & Johnson vaccines that were given prior to the halt, 28 people were diagnosed with that, with the clotting issue, and they put it on hold to investigate further. 28 out of 7.8 million. That number is ridiculously small, and that's how sensitive these systems are that are keeping watch over the vaccination process.
We see it. Yeah, we'll see it.
Okay. The next question that was from last night was, my husband and I are fully vaccinated with Johnson & Johnson. We have 3 elementary school age children who are not only around classmates, but around a lot of other non-vaxxers outside of school. Is it safe for us to spend time with them? I've been waiting for better weather to be able to do things, but what about overnights, etc.?
So we're getting more and more clinical information that if you are fully vaccinated, you're in pretty good shape. Not only are you not likely to get infected, the post-vaccination infection rate appears to be even less than 1%, but you're not likely to spread it either. So I would say if you're fully vaccinated, enjoy your grandkids. Now use some common sense. If they're ill, that's a different circumstances. And if you're ill or you're around people who are ill, I would still take precautions like masks and trying to keep that 6-foot distance away from them, etc. Because why push your luck, right? People still do get sick after getting vaccinated from COVID. And we've had a handful of those people even get sick enough to be hospitalized and die. So the risk is still there, but it's much, much smaller. And I think it's small enough that if you were vaccinated, I'd say go ahead and enjoy your grandkids. But keep telling them to vaccinate. I mean, keep pushing it. If every person who's been vaccinated convinces one other person to vaccinate, we could get to that 70% by the end of the summer. So every one of you that's done it successfully, if you can just convince one other person, it would be a real benefit to us as a society. Okay.
All right. What makes the effectiveness 100% of the Pfizer vaccine for kids and lower for adults? And if they know, why can't it be done for adults?
Well, that's 2 things. So this is the complexity of statistics and clinical trials and biostatistics. If any of you have ever taken biostatistics, it's not easy, okay? This is why we rely on experts. So 2 things going on there. One is the clinical trials for the kids was smaller. The other thing, though, is we also know that kids don't get as many symptomatic infections, and the efficacy trials in this situation, there was several thousand involved in this. Their endpoint was clinical symptoms of COVID. So they weren't checking blood work for serology or doing swabs to see if there was virus there. They were waiting for someone to report illness. And we already know that kids don't often feel ill while they're infected with COVID. So I think both of those factors could be involved. Please don't expect that a vaccine is 100% effective. I've said this before, but there is no medicine known to man that is 100% effective. There is no vaccine that's 100% effective. There's nothing that's 100% except maybe death and taxes. And we know that even taxes can be evaded with the right amount of skill. So
that's what we call a left turn. But
okay.
Okay, we'll move on. The next question from last night was, if needed, can you receive the monoclonal antibody treatment if you've had both of your vaccine shots?
Yes, you sure can. So I'll read this right out because staff did a nice job doing this. So per the CDC, for vaccinated people who subsequently experienced COVID-19, prior receipt of a vaccine should not affect treatment decisions of any kind. That would include monoclonals, convalescent plasma, antiviral treatments, steroids, etc. Nor does it impact the timing of such treatments. So if you got your vaccine yesterday and you get sick the next day, you should still receive all the treatments that are currently available. Good question.
All right. Thank you. All right, we're moving on to the live questions now. This is from Lori. She says, new mask mandate, question mark. The new announcement we heard just
someone was going to
before we
ask that
came on.
question.
First question of the
it
day.
came out 10 minutes. It came out 10 minutes before we got online.
Isn't this fun?
ahead,
We have so much fun. So yes, the CDC has released some new guidelines that basically say that anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. And then they go on, they have a lot of caveats. That is obviously contrary to the current epidemic orders that are in place, because the governor has kind of continued a lot of the mandates based on, as you remember, the vaccination rates. So, the idea that every time we do a better job with vaccinations, then she's going to lighten up the restrictions. So state and local laws supersede CDC guidelines. And as you guys know, there's a lot of things involved besides just the science. There's the scrutiny of the science, which in itself can be very complex. And then there are all the other issues that go into some of these decisions. So right now, MDHHS epidemic orders still pertain. So the things that you know about when you should mask and when you can't mask still are in place. There is absolutely going to be some robust conversations about this tomorrow morning, I'm sure, or maybe even now, I'm sure, and more to come. So the other thing I just want to say, because Justin and I talked about this, is deep breath, people. This has been going on since, how many days have we been, the EOC's been? 600 and,
Well,
no,
it's been going on
forever.
since January 20th, 2020.
Forever. So
60 weeks.
if we need a couple of days to work through this, that's what's going to happen. We're going to do it. Just use your head, people. Continue to wear your mask in situations where you think there's people who are unvaccinated or you're going to be in close quarters. Please, 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 if you're sick, preferably don't go out and get tested, but certainly wear your mask. If you're unvaccinated, please keep wearing your mask, and we'll get there. We'll get there. But this is one of the more instances where the CDC has kind of released some ideas and guidelines that it's going to take a little while for policy to catch up to the recommendations.
All right, thank you. The next question is from Bonnie. Does a Depo Medrol shot in the hip affect how well the vaccine works?
Probably not. And you know what? I promised somebody else I was going to go over the specific doses of prednisone and cortisone that you would receive as an outpatient and where that would impact and how long you should wait before you get vaccinated. So I think if I'm correct, the single shot of Depo Medrol is not a contraindication to getting vaccinated within the next 24 to 48 hours. Bonnie, I will, we'll try and get that specifically out of our vaccine experts, and I'll get back to you about that.
All right, next question is from Sharon. Are the symptoms of COVID variants different from the initial COVID-19 infections?
I don't think so. We still don't have a lot of good science on the variants as far as, knowing a lot about the variabilities. We're having a hard time even trying to understand the therapeutics and how they're impacted with the variants. Still studying that very aggressively. We do know many of them are more transmissible, but some of those subtleties, like do they cause slightly different symptoms or more severe symptoms, or how the therapeutics are impacted, are still being actively studied. So I don't think in any significant manner, as far as something we're going to have some broad change in what you should be looking for. No.
Okay, Nadia says, can you please provide the double-blind study that shows the vaccine is more effective than natural immunity?
Sure, I'll have to look up that data for you. Nadia, could you send your contact information to our COVID-19, and we'll be happy to provide you that information.
Yeah, we're not just making it up, I promise.
I'm not making it up. Now, have I read the study myself? Well, but I'll make sure I get that data to you.
Somebody asked, Denise, how many people are being vaccinated weekly in St. Clair County now?
Weekly? 6,000?
Yeah,
okay.
there you go.
So yeah, there we go. So the answer is a little over 6,000 per week, but for first doses, that's considerably less. It's under 2,000, is it not? And every week we've watched that come down. So that yellow bar is the second doses, and the blue part of that bar is the first doses. And you can see that there's been steady decrease for the last 4 or 5 weeks.
All right. Well, it looks like we don't have any more questions. So
Really?
I guess we can close. It's 4 o'clock. So if you guys want to do some closing comments, we'll go back to the old school way of doing a half an hour.
I gotta ask, how long should we do these? I've gotten to the point where I enjoy these because it gives me an idea of what people are thinking and what they want to hear about. And I hope you guys are calling in regardless of what your concerns are, because it's a nice way to communicate with the public. There are positives and negatives to social media, and this is probably one of the more positive ones. So thank you for joining us. I feel very optimistic, this week, starting the week out and watching the case rates come down, watching the data come in, showing just how effective these vaccines are and how safe these vaccines are. I really think we as a community and the country as a whole could be in a very different place by the end of the summer, and a much more positive place for when school starts and everything else. So there is a light at the end of the tunnel, and it's getting brighter and brighter. And that is a wonderful thing to share with you guys. So talk to you next week.
Justin?
Thanks, Doc. And what I would say is, I agree with Dr. Mercatante completely. The light is definitely getting brighter. We're getting closer to being able to do, all the things that we used to be able to do and not think about. We just have to kind of remember that there's a virus running around, and it doesn't care who it infects. It's just looking for the next infection. So as always, I thank everybody for your time today, and we appreciate you coming back week to week, and we'll see you next week.